Welcome to Bench to Boardroom, where life sciences leaders come for signal, not noise, concise insights, sharp strategy, and actionable ideas shaping biotech, pharma, medtech, and healthcare. We're glad you're here. In today's episode, we'll talk about the launch execution gap, or why great medicines still miss their forecasts. Let's begin with a statistic that should make every life sciences executive uncomfortable. Because approximately 34% of US biopharma launches miss forecast expectations. Even more revealing, nearly 2/3 of senior industry leaders, 64%, attribute underperformance primarily to poor data and analytics. Now pause for a moment. We're talking about organizations capable of sequencing genomes, engineering cell therapies, designing antibody drug conjugates, and navigating some of the world's most complex regulatory environments. Yet many still struggle to accurately predict and execute a commercial launch. That should tell us something important. The problem isn't intelligence. The problem is execution. And more specifically, the problem is translating information into decisions and decisions into action. But I'd argue something even broader. The same thinking that causes organizations to miss launch forecasts often causes them to miss business objectives more generally, market access objectives, growth objectives, portfolio objectives, commercial objectives, and strategic objectives. Because underneath many missed targets lies the same root cause, a willingness to operate with information that is merely good enough. In today's environment, good enough has become a losing business proposition, especially as artificial intelligence and advanced analytics begin separating leaders from followers. The challenge, of course, is that making smart investments in AI is anything but straightforward. So today we'll discuss why. The real problem isn't data. The industry often says it has a data problem. I disagree. Most organizations have more data than ever before. Clinical data, claims data, prescription data, real-world evidence, medical affairs insights, CRM data, market access data, competitive intelligence. The issue is not data availability. The issue is data usability. The issue is context. And increasingly, the issue is connectivity. Because disconnected intelligence creates disconnected decisions, and disconnected decisions create underperformance. So, for root cause number one, it's probably that analytics that never reach the field. Let's start with the common scenario. A launch team builds sophisticated forecasting models. Commercial analytics teams identify opportunities. Patient journey analyses reveal bottlenecks. Access data identify reimbursement barriers. Everything looks excellent on PowerPoint. Meanwhile, the field organization remains largely unchanged. The insights never meaningfully alter behavior. The organization confuses analysis with execution. This is one of the most common forms of value destruction in life sciences. Not because analytics were wrong, because they arrived too slowly, or weren't operationalized, or weren't embedded into decision-making. The organizations outperforming today increasingly focus on translating analytics into field action quickly. Not quarterly, not monthly, sometimes weekly, sometimes daily. The competitive advantage is no longer simply knowing something first. It's acting on it first. What's root cause number two? It's the data connectivity problem. Now let's discuss a challenge many executives underestimate. Most organizations still operate through functional silos: clinical development, regulatory, medical affairs, market access, commercial, manufacturing. Each function may have excellent data, yet very few possess an integrated view. The consequence? Decisions become locally optimized rather than globally optimized. Consider a hypothetical oncology launch. Clinical teams understand patient segmentation. Regulatory teams understand label constraints. Market access teams understand payer requirements. Commercial teams understand adoption dynamics. Yet if those data sets never meaningfully connect, organizations may fail to identify critical launch opportunities. The result isn't necessarily catastrophic failure. Often it's something worse: incremental underperformance. The kind that slowly erodes enterprise value while remaining difficult to detect. A few percentage points lower uptake, a few months slower access, a few delayed reimbursement wins. Collectively, these can destroy hundreds of millions in NPV. And for root cause number 3, speed of activation. The third challenge is speed. Not data speed, decision speed, activation speed. Many organizations continue making decisions at a pace designed for a previous era. Markets don't operate that way anymore. Competitive landscapes evolve rapidly. Payer behavior shifts. Regulatory interpretations change. Evidence accumulates. Physician behaviors evolve. The winners increasingly operate through what I would call a continuous learning loop. Observe, analyze, decide, act, repeat. AI can accelerate each of those steps, but only if embedded directly into workflows, not treated as an isolated technology project. This is where many organizations struggle. They purchase AI. They don't operationalize AI. Those are two very different things. Now, internal build versus third-party expertise. This raises an important strategic questions. Should organizations build internally or engage external partners? The answer, as always, depends. Internal capabilities provide control, institutional knowledge, long-term scalability, but they require significant investment, talent, infrastructure, governance, change management. Third parties often provide speed, specialized expertise, proven methodologies, and access to broader data sets. The strongest organizations increasingly combine both. They own strategic decision-making, but leverage specialized external capabilities where differentiation is limited. Importantly, they avoid creating disconnected technology ecosystems, because AI delivers its greatest value when operating with a natively connected environment. Clinical, regulatory, market access, commercial, supply chain, all information informing one another. The future belongs less to individual tools than to integrated intelligence. And that's why AI matters more than ever. Let's be clear. AI is not a cure-all. It won't fix weak strategy. It won't replace leadership, and it won't eliminate uncertainty. And it certainly won't manufacture perfect data where none exist. Life sciences remain fundamentally constrained by incomplete information. Most strategic decisions still occur under conditions of uncertainty. That isn't changing. What AI can do is help organizations navigate uncertainty better, identify patterns faster, connect information more effectively, prioritize resources more intelligently, and accelerate decision cycles. In short, AI doesn't eliminate uncertainty. It improves decision quality despite uncertainty. That distinction is critical. So who are the emerging winners? The organizations pulling ahead are not necessarily those spending the most on AI. They're the ones integrating it most effectively. They focus on connected data ecosystems, decision acceleration, workflow integration, field activation, cross-functional visibility, and actionable intelligence. Most importantly, they treat AI as a business capability, not a technology initiative. That mindset difference may become one of the defining competitive advantages of the next decade. So for a final thought, many leaders still ask, what is our AI strategy? Increasingly, that may be the wrong question. A better question might be, how quickly can we turn intelligence into action? Because value creation across the portfolio increasingly requires a proactive approach to data, software, and decision-making. Organizations that skillfully integrate AI into a connected ecosystem can accelerate ROI, improve execution, reduce organizational friction, and ultimately increase the impact of every strategic decision they make. And perhaps that is the most important lesson of all. In an industry built on innovation, competitive advantage increasingly belongs not to those who generate the most data, but to those who act on it first. Thank you for joining us on Bench to Boardroom. Always selective, always original, always actionable. Until next time.